Hello, everyone. I'm Sami Abuzaid, a US-based cardiologist and co-chair of the International Cardiogenic Shock in Abu Dhabi. And today I have our guest speaker, Dr. Jordi Bañeras, an internationally recognized leader in cardiovascular critical care, acute coronary syndrome, and simulation medical education. He's our distinguished faculty member of the first International Cardiogenic Shock. Dr. Bañeras is an intensive cardiac care cardiologist at the Val d'Hebron University Hospital and is associate professor of medicine at the University of Barcelona. He has devoted his clinical and academic career to improving outcomes in cardiology and critical care, particularly in high-risk population and cardiogenic shock. Um, Beyond his clinical expertise, Dr. Bañeras is a globally recognized leader and authority in medical simulation and education, and he served as the chair of education of the Acute Cardiovascular Care Association of the European Society of Cardiology, and he's a member of the ESC Education Committee, helping shape how acute cardiovascular care is taught worldwide. He coordinates the Hospital Advanced Simulation Center, co-direct the Spanish National Simulation-Based Training Program for Cardiology residents, and co-creator of the Simulation Lab, which is an award-winning virtual simulation that take care of high-risk population and cardiovascular emergencies. Welcome, Dr. Bañeras.
Thank you so much. It's my pleasure being part of this amazing conference. And thank you for your kind presentation.
So welcome, Dr. Bañeras. It's an honor to be here with you today. So we'll start with asking some questions. So we'll be speaking about cardiogenic shock simulation in 2026. Can you tell us what attendees can expect from this session and why simulation has become so critical in the care of cardiogenic shock patients?
Yeah, sure. If I'm allowed simulation in 2026, for me, it's no longer training. Simulation, it's an infrastructure for safe critical care cardiogenic shock patients treatment because it's a must at the end. Nowadays everybody knows that cardiogenic shock it leaves a lot of deaths. There is a high mortality, more than 50%. There are a lot of overload, cognitive overload. There is a lot of pressure. The time critical decisions really make the difference. And we are expected to deal with all of this. So how come we're going to do this? So simulation is the best place for training before just dealing with this. So I would say that, yeah, everybody knows that the healthcare system is the most dangerous system in the world. So if the professionals are training to be pilots in aviation, if professionals are training to be in other professions in terms of safety, we really need this in cardiology, but especially in cardiogenic shock, because the mortality is really very high. And even we have a lot of drugs, we have a lot of devices. If we don't coordinate, so if we don't train this, we cannot expect better results. So for me, I think that the audience have to expect that the simulation is going to improve their outcomes.
I guess that's a very interesting point because what my second question was about like your experience in intensive care cardiac units. Where do you think teams most commonly struggle during the care? And I think you kind of like partially answered it. If you would like to elaborate a little bit more about it.
Yeah, this is a really very important or crucial question because when you go to the university, you are really very trained in knowledge. But then in the first day, you go to the hospital, and there you have to talk to the others, to the nurses, to other healthcare professionals. You have to be familiar with the environment, and nobody has taught you about this what we call non-technical skills. So I think that in simulation, of course, we can train how to deal in cardiogenic shock with an ECMO, with an Impella, with a Hermet 3. But what makes the difference at the end, because people really know what they have to do. Of course, they are, in terms of competence, they are competent in technical skills. But what about these non-technical skills? Non-technical skills is like a concept sometimes really very difficult to understand, but there are all of these skills when there are two or more people that they are together and they have one objective, they have to work. So when there are a lot of factors that determine which is going to be the result. So just to be concrete, with simulation, we can train, teamwork. We can train a lot of skill communications because the communication is the first cause of errors in most of hospitals. So this is really very important as well. So you can train this decision making, the situation awareness, all of these skills that you have to be inside the hospital for being trained on that. So simulation is the best opportunity in 2026 to train on that. Even if I've been working or dealing with cardiogenic shock patients for 20 years, if I'm training or I just give the opportunity to be trained with these non-technical skills, for sure I'm going to have better patient outcome results.
Yeah, that's fantastic. And I think I like the analogy about resembling this with the simulation in aviation, right? And how safety important to land and have good outcomes. And that will not happen unless we have a well-trained team, right, with know-how to communicate. And that will take some time and take some training and passion as well as yourself and all um, the cardiologist and intensivist taking care of such sick patients. So I think this is very important for the new generation to adapt that in their training and education. But it's important also when being involved in cardiogenic shock, how you think that helped you as a clinician in the bedside to have in the decision-making process in real life, right? When you have a shock patient and you have that training before, and now you're on the simulation behind, and you make the decision. How you see that in reflection?
Yeah, I love this question because at the end, there are a lot of hospitals, and sometimes they argue that they don't have a simulation center to be trained. But at the end, you have to train the simulation teams, or you have to use simulation for training the teams, just sometimes using what we call in situ simulation. So if you have a cardiogenic shock team, you can start training tomorrow. By tomorrow, I mean just you have to understand what are the basic principles and how we have to talk, how we have to debrief, which are the opportunities for just learning for the next time. So we know that in cardiogenic shock, there are a lot of sometimes misunderstanding because, sometimes I'm just asking for, as you know, for the preload, and someone is just saying just the CVP, the central venous pressure. So no, come on. I mean, there is just, in your mental infrastructure, there is like, a mental confusion. So nobody's going to talk about this in a real patient. But if you are in simulation, then there is like a safe environment. Then you can to talk to the others and say, oh, okay, there is this mental frame could be better. So let's talk about this. So when you're dealing with a real patient, after that, for sure, I mean, you're going to have better results. So I just gave you an example, but in terms of the perfusion, sometimes people are confusing with the mean arterial pressure as well. So I'm not going to talk about this with a real patient because in cardiogenic shock, I mean, there is a lot of things to do. So the best place for doing this is in simulation. So, and you don't need to have like 2 hours. You can just use simulation like 20 minutes per week with your cardiogenic shock team, and then, but be really very concrete with one specific objective at the same time.
Yeah, I'm personally looking forward to learn and from you because this is something I'm passionate about, education and stimulation and all of that, because I think it's going to affect our patient care for sure. Now, as we're talking about building teams, right, and many centers are different stages of their developing their shock team or who involved in the team. So from your experience, what are the essential elements of an effective cardiogenic shock simulation program that any hospital can realistically implement?
Yeah, I think that's a really very tough question at the end. But starting from the beginning, I think that, first you have to learn like the basic things that we really provide in simulation. So like, we have, I mean, these really basic rules is like, we have to create what we call like the safe environment. psychological environment that you can talk to each other, you can express what's inside you, you can express your feelings. So the first point is that sometimes you have to change the culture of your team. So there is no blame there. Every error is an opportunity to learn. So sometimes, we have to make sure that everyone in the team is in the same frame. After that, when they understand the basic rules, there should be like 2 or 3 people who are like the leaders who can facilitate the conversations, because sometimes, there are really very difficult conversations. Cardiogenic shock, there is 50% of mortality. So sometimes we are really happy, sometimes we are not at all. So you have to deal with this. So you have to be really very prepared for dealing with, all the team, in terms of, in the healthcare professionals, sometimes there are what we call the second victims. When there is one error and I'm just feeling really, really very bad. So I have to manage with this if I'm a facilitator in simulation as well. So these basic things for me are really very important. So even I say that, okay, you can start to do your simulation program in situ, in situ. You really don't need to have like a simulation center. You can do it in your unit. But of course, there should be like 2 or 3 people who are like the facilitators, and they know how to deal with all of these issues that they are really very important in terms of psychological safety issues.
That's fantastic, and I think you make us all excited about seeing the simulation and prepared to kind of like adapt this technology and be part of this new innovation in our first International Cardiogenic Shock in Abu Dhabi soon in January. So I really thank you very much for your insight, and looking forward to see you in Abu Dhabi.
Thank you so much. I'm looking forward for that. Thank you.
Thank you.